Good morning, Dr. Szapocznik. This is CG Yuan from Southern Finance. So I would like to ask you something about mental health in post-COVID era. In the US, there has been a dramatic spike in school violence when students return to in-person learning after months of homeschooling. This week, a 15-year-old has killed 4 students and wounded 7 others, including a teacher in Michigan's Oxford High School. So as a psychologist, do you think there is a possible link between these cases and the lack of mental health support for students during the pandemic?
There are many challenges in having been isolated at home and for children to have been away from other children for such a long time. And of course, some of these challenges is the stress of being in COVID and being isolated, and parents not being able to work because they had to care for their children. So a lot of families have experienced a great deal of stress. There is no question about that. And we do not have in the US a national proactive mental health delivery system. But I think the biggest problem is that guns are so available in our country. And as you know, in one of the most recent case in the US, the parents have bought a gun and the child took that gun to school. So the availability of guns is a huge problem in this country.
I will follow up for that question. So what could we do to strengthen people's mental health, especially for children and teenagers from, just like you mentioned, the isolation and trauma in the post-COVID era?
The single most important influence for children's mental health is their parents. And so I've been part of an initiative at the National Academy of Medicine of the United States, where we've talked a great deal about the fact that parenting is prevention. So what those of us in the family therapy field recommend is very much support to the parents. That is the best way to help the children, because it's the parents who provide the 24-hour-a-day environment to the child. So from a family systems perspective, we improve children's mental health by supporting the parents.
In general, when can we get back to normal according to your projection?
This virus is no longer controllable in a single country very easily, at least not as long as we have travel from country to country. The only way to control this virus is to control it in the whole world. So until the whole world is vaccinated, we're not going to successfully control the virus anywhere. As new variants become more infectious, the percent of persons who have to be vaccinated increases. So initially, with the Alpha variant, we were talking about maybe 70% of the country being vaccinated. We may be able to achieve herd immunity. Then with subsequent variants, we were talking about 80, 85. We don't know with Omicron, given its infection rate, what the percent of people that will have to be vaccinated will be required to achieve herd immunity. That means when we're able to interrupt the transmission of the virus in a society. So I am concerned because here in the United States and in other countries, there are many individuals who do not want to be vaccinated because there has been so much misinformation about this vaccine. This country and many other countries may not be able to reach the vaccination rate, which may be 85 or 90%, that's required because of people who object to taking the vaccine. We may have to live with this virus the way we live with other viruses, like influenza, or the way we lived at one point with measles and polio. It's not a good picture, but we may have to learn to live with the virus. I hope that doesn't happen. I hope that enough people are willing to get vaccinated.
Doctor, could you talk about what are the potential areas for cooperation between China and the US in public health? And which is maybe, in your opinion, which is the best part to start to work together for both countries?
I believe that there are areas of great tension between our countries. And even in the face of those disagreements, we must find ways to work together in those issues that not only affect both our countries, but the whole world. So I think we have to put our differences aside and work on public health together. We must support a legally binding international agreement, both countries must, that has all the required components for equity, for distribution of production of vaccines and treatments, for regulations on how to prepare and how to respond, for surveillance, for monitoring, and for incentives and disincentives.